And we told you in our 10 Investigates special Overdosed how nearly 3 people die every day in the Tampa Bay area from an overdose. 10 Investigates' Emerald Morrow joins us now with another disturbing trend. And Emerald, how the CDC is looking to address the uptick in this epidemic.
That's right, Courtney. The CDC says there was a historic 30% increase in drug overdose deaths between 2019 and 2020. And fentanyl is now disproportionately impacting people in communities of color, a trend we have told you about happening right here in the Tampa Bay area. Nationwide, overdose deaths went up 44% among Black Americans between 2019 and 2020. There was an 86% spike with those between 15 and 24 years old. Doctors say the pandemic disrupted access to prevention and treatment options. Experts say it also made people more stressed, and some might have turned to drugs to cope. Researchers say this became easier in many lower-income Black communities as drug lords and traffickers targeted these areas for fentanyl distribution. Take the Childs Park neighborhood in St. Pete, for example. Right now, police are investigating a major drug ring where they say dealers tested fentanyl on known drug addicts and had them report back just how strong these drugs were. Researchers studying this problem say we have to address why people are turning to drugs in the first place and how to get them help.
Why would people turn to these substances? One, they don't have access to alternative means of coping. Two, even if they have access, they may not know they have access. So one of the major barriers is health literacy.
The CDC reiterated today communities have to address those systemic factors and must continue to show just how lethal fentanyl can be. Researchers say communities must also improve access to care. And taking a deeper dive, the CDC says fentanyl is 50 to 100 times more potent than morphine. Doctors prescribe the synthetic opioid to patients who are in severe pain, like those going through advanced cancer treatments or even hospice care, because it doesn't have to be given in a pill. But people also make the drug illegally, and it's often mixed with heroin or cocaine for its euphoric effects, sometimes without the user even knowing. And two things the CDC also say they're also watching is the use of fentanyl testing strips and data about supervised centers from New York. Now, we showed you the efforts to broaden the use of both of these in our Overdosed special. You can watch it in its entirety on our 10 Tampa Bay YouTube page, and there you can also watch my full report on the impact of fentanyl on our local Black communities.